What are your favorite Ayurvedic medicines that you use in your practice, which are having Shatavari as an ingredient?
No, that's the thing. I use it as a Shatavari churna and many of the galactagogues available in the market, like Shatavari granules and many of the things, galactagogues like things. But one of the traditional thing which I use it is in most of the cases of renal parameters, particularly renal calculus and UTI and those conditions, and even in the particularly those areas where the urinary tract is involved, or where there is a urinary output or insufficiency is there, urine output, you can say it is a mutra krichrata, whatever it is. In those conditions, I prefer using Shatavari Adhikruta. This Shatavari Adhikruta is one of the important thing. Then other than that is the Mahanarayana Taila. That's a wonderful drug, you know that, and it's one of the commonest one what we use in practice. And that Mahanarayana Taila is one of the basic formulation of Shatavari. It's also called as Vaishnavi. There's some parameters, I mean, synonymous names are there for this Shatavari. So this is one of the wonderful drugs, Shatavari. We use it in even Shatavari churna in case of male factors where there is a spermatogenesis, some sort of problem with the manufacturing or production of the sperms. So then in that condition also you can use this accordingly. So first thing is we need to understand the basic module or the person's whole nature, or is it doshic imbalance, all those things. Then accordingly try to select those drugs or combinations or yogas which fit into our category of how can we can break the pathogenesis. So Samprapti Vikatana may be kept in mind, and accordingly a drug selection is to be done.
Sir, I just wanted to ask about the Shatavari. Can this Shatavari Churna initiate early secondary changes in those female, those who have not attended puberty, like around between 11 to 13 years of age? If we give Shatavari Churna along with the milk instead of adding all those market products, so does it initiate any early secondary changes in them?
No, I don't think so, because Shatavari has a Stanya Vardhana effect. You understand that, a Stanya Janana effect. That Stanya Janana can happen only after delivery. So there should be some prerequisite condition that can only initiated by the drug. It doesn't initiate any action which is of this nature, of producing secondary sexual changes or bringing a early premature menarche. All these things will not happen. This is not a thing of initiating of that level. It won't work in that fashion.